So now we start with the second lecture. We'll have a short lecture and then we will give you some assignments. We'll divide you in 4 batches. We've already told you the groups. You can later on look at your groups. Which group do you belong to? And then we'll give you some assignments. So we come to principle of ethics. Dr. Rakesh already talked about ethics and discussed what is ethics and something which is there in your day-to-day life. So by the dictionary, if you go, so these are the moral principles that control or influence a person's behavior. Irrespective of whether you are a doctor or not a doctor, you have certain ethical guidelines which you practice in your day-to-day life towards everybody, a patient or not a patient. So for a medical ethics, it is basically what is your code of behavior when you are in the medical profession. So anybody would like to tell me what are the principles of ethics? Dr. Rakesh pointed out, and you can just let me know. I think all of you must be aware you have gone through your MBBS curriculum and that talks about principle of ethics. Anybody? Just say aloud. Yeah, good. I couldn't hear something. Say aloud. Beneficial, but what else? Autonomy, good. Very good. Justice. Okay. So that is what are the core principles of ethics. So we talked about autonomy, non-maleficence, beneficence, and justice. Good. So now this is what is the ABC of ethics. That is autonomy, beneficence. C is also confidentiality in the medical profession. That is very important. And non-maleficence is also known as do not harm. I'm trying to put it into ABCD. So do no harm becomes non-maleficence, and justice is equity. We'll talk about it later. So this is what is the ABCDE of ethics. These are the core principles of ethics. Okay, what is autonomy? Auto, AUTO. Yes, autonomy cell, very good. In the medical profession, what do you think is autonomy? Anybody will read up what is written on the slide and then explain? You basically, when you look at any individual, a patient, a pregnant female may not be called a patient. So any individual who comes to you for medical advice, so you tell them the various possibilities and then you honor the decision which is being made by the person. What is the choice? Is the choice of the participant in a research. In patient care, it is a patient, and people who come for medical advice, it is a person who is involved. So it is basically the respect for persons, and you are basically honoring the decision of that individual, and that is autonomy, which is generally honored, not even just in the medical profession, in any profession. So basically, it is an English word which talks about voluntariness, that you honor a person's voluntariness to make a decision, right? So that is what is autonomy. So it may be, as I said, it may be in research, it may be in investigation, it may be a treatment. So that is what is autonomy. So, and you may think the decision which is being made by that person is not right according to you, but according to that person, it may be right, according to his or her circumstances, the environment he or she is in. So it may be a bad decision according to you, maybe a good decision according to them. So that is what we are supposed to do, is honor everybody's decision. So as you said, auto is self and one person who's in charge of the self. Okay. So in medical profession, the patient or the participant or the person who is involved, who is talking to you, is the primary person you are obliged to and take and honor the decision of that person, irrespective of the decision of the other family members. Of course, there are riders to that, but yes, more or less, you are trying to honor the person who are you talking about. Okay, now we come to beneficence. So what is beneficence? As the word says, trying to, what is your, basically you want to benefit somebody, right? So your aim should be that whatever you do in the medical profession or in the research, that should be of use. It should be benefiting to the person that is involved. So you're trying to do some good, acting in the person's interest, right? So if, for example, in a research, you are trying to give a drug, so you'll have to weigh whether what are the risks of giving that medicine or what are the benefits. And then the benefits should be more. So the weight should be more towards benefits as compared to the risks which is involved. So that is what is basically trying to do good. It is almost like some way opposite to what we say is do no harm is the first principle, and then trying to benefit is the second principle. Okay, let us look at an example. You can read it yourself. So this is a lady who is diagnosed of breast cancer. She attends an oncology clinic. The treatment options are told to her, and she is not willing to undergo any form of radiotherapy or chemotherapy. Okay. And as I said earlier, we have to have some riders, whether the patient is in full capacity to make an informed decision. So whether you may have people who are vulnerable, like children, or sometimes illiterate, who do not understand what will be the implications of certain treatments or otherwise. So once you know that that patient is in full capacity to make an informed decision, you have to identify the ethical principles. How do you deal with this? So what do you think is the ethical principle involved in this? So she says that she is not willing to any form of chemotherapy, radiotherapy at any stage of her management. And that is what she wants. What do you think? What are the principles involved? And what do you think you should do? Two questions. One is autonomy. So autonomy for the patient, right? Second is beneficence. Good. So the beneficence is that we are trying to do good. As a doctor, the doctor is trying to do good and advising the patient to have chemotherapy and radiotherapy so that the disease can be treated and managed properly. However, the patient does not want it. So that is the autonomy of that patient or participant, whatever. So what do you do with this? That was the question. So what do you do? I respect your decision. We will not proceed with any other further treatment. That is fine. That is complete autonomy. I respect your decision, but it is my obligation to tell you that this is not the best course of action, right? So that is also your obligation, that you need to explain that patient properly. In spite of explaining, the patient refuses, then it is her or his decision, right? And then the third choice is, I will discuss your choice with all family members and other medical team members and act according to my wish. Of course, that is not autonomy for the patient, right? That becomes your autonomy. Whatever you want, you will do, right? So that is not which is to be done. For in the medical profession, it is the autonomy of the patient or the participant which has to be respected in all counts, keeping in the principle that you do not do any harm and try to do good, right? Okay, so as I showed you, this is the best thing that you can do. So you have to explain to the patient that this is what has to be done. And then if she refuses, then it is her decision. That has also has to be respected. Okay, so this is autonomy. This is about beneficence. And you have to weigh both of the things and then decide. Of course, the patient has the last call. Okay, now we look at the second case. Anybody would like to read it aloud? The last row, first person. Yeah. Physical examination and investigation with poor proficiency in the report is incapable of repair, for temperature is recommended, the patient has a test to make the decision, he refuses to get it in temperature. What do you think? What are the principles involved? Good. What is the autonomy involved? One person, put your mic on. It's quite easy. Who wants to say? You can continue, or the second person next to you. What is the autonomy? Patient is saying, I don't want to get an amputation. That is the autonomy of that patient. Okay. What else? Next. Any other principle involved apart from autonomy? What is the beneficence in this? What do you think? Right. Okay. Anything else which is involved? Right. So this is autonomy. That is the patient's decision. Beneficence is the best interest of the. What do you do in these circumstances? That was a question. What is to be done in such a, as a medical doctor, what do you do in such circumstances? That is, you have to try first to understand why that patient or person or a participant is making a particular decision. So you have to see what is whether the capacity to refuse treatment lies with that patient. The patient may be critically ill, may be very elderly, sometimes incapacitated, mentally he cannot think or make his own decisions. Maybe a very small child, you're trying to do some procedure. So you have to attempt to understand whether the patient or the participant knows what is to be done. For example, an illiterate person, maybe you're not able to explain that person properly. That is why that person is making such a decision, right? So you have to explain that if you do not do the amputation, what will happen? Just saying that an amputation has to be done, you will have to explain to the patient why an amputation has to be done, what are the benefits and the risks of either ways for the procedure. And of course, you have to identify the emotions and the apprehensions, provide information, and of course, reassure. So this is what has to be done to have both the principles and for the best interest of that participant or a patient or an individual for medical advice. Okay, but as I said earlier, patient or the participant still has the right to make the good or the bad decision. Still the decision making goes, you have to honor the decision of that patient or the participant, right? You have to explain everything and then honor the decision. Okay, so non-maleficence. It was talked about. Do no harm, right? Okay, so maleficence is any harmful act and therefore it is do no harm. It is a universal principle. And when we talk of non-maleficence, you have to talk it in a larger way. Just not about human beings, you also have to talk about all living beings and the ecosystem also. So you have to remember that whatever research you are doing, you're not just bothered about the human being that you're talking about. You're also talking about the ecosystem, that you don't spread something or do something which is not good for the society at large. Okay. So let us come to an example. Anybody? Last row. First person there. Madam? Yeah, please read it aloud. Do you think anything? What are the ethical principles? Any ethical principle when you do a renal biopsy involved? Okay, do no harm because it is a risky procedure, right? You have to be very sure that you're not doing it just because you want to have that participant in the research study or something, right? You're doing it for the patient's benefit, right? So this is do no harm, right? Anything else? So this is about beneficence versus not. So you have to weigh. You know that renal biopsy in some way has some risks, but you also need to weigh whether there are any benefits or not. And then you have to act accordingly. So this is just a simple example. It goes for larger procedures also. Okay. So what is harm? What do you mean by harm? When we say do no harm to the human beings, the ecosystem, animals, what do you think is harm? You do a renal biopsy, the patient starts bleeding, right? That is a harm. But what type of harm is it? It is a unintentional, yes, but it is almost like a physical harm, right? What else can be that type of harms? So it is not just a procedure as in medical terms will cause bleeding or cause some avulsion or cause some pain to the patient. This is not just about physical harm. It is also about something else. What are the something else which can be? Anything else which comes to your mind? Yes, good. Financial, yes. You're trying to do a procedure. The patient cannot afford it. You have to see what In that terms, you also have to see what are the benefits and the risks, whether the patient will have to take a loan to do that procedure, whether it is really required. So what is the benefit in terms for the patient as compared to the risk of repaying the loan, right? So that is a financial good. Anything else? Right. For this example, yes. But for other examples, psychological harm is also there. So for example, you are doing something, you have a HIV positive patient. You have to see that the confidentiality has to be maintained. You have to remember that you do not have to divulge the details, because there is a psychological, I'm just giving you an example, right? There are a lot of things which are related to some psychological aspects in the families, right? Okay, so this is one thing is physical, one is psychological, one is financial, emotional, right? So you may have some traumatic experiences, social harm. Sometimes you have a lot of stigma, like I told you about HIV. You're doing a lot of genetic tests, NGS nowadays, right? You may detect some abnormality or a genetic defect, which may have not only a psychological harm to this patient or society in large. If there is an unmarried girl or an unmarried boy, you detect in genetic test. So there will be society at large will start saying that what will happen later, right? So there are a lot of harms. So as a medical person, you have to remember that you have to cover it all up and see that what is in the benefit of that particular patient. So you have social harms, you have psychosocial harms. There is a lot of information which is coming in. And of course, as I said, don't disclose any information related. Confidentiality is important, and economical, as you said. So there are a lot of harms. Instead, when we remember as harms, we only remember about the physical harms, the pain and all those things. But you also need to remember that there are a lot of other things which you have to take into account. Okay. And of course, sometimes a legal thing also comes in. So let us now look at this. What do you think? Last row, first person with a bag sling. Yeah.
18-year-old boy with a root canal accident is brought to the emergency department. He has to be placed on a ventilator for life support and is later determined to be brain dead. The physician informs the family, who are the legal decision makers, that in his professional opinion, life-sustaining measure should be withdrawn. The patient's family objects to for the withdrawal of the ventilator.
What do you think are the ethical principles, and what do you think? Autonomy of whom? Yeah, because at this point, as compared to the other patients which we were talking about, they were all had, you remember I wrote, they had full capacity to make their own decisions. But for this patient, they is on ventilator. So now the legal guardians or the legal decision makers have come in, right? So one is autonomy. What else? Beneficence, right? Beneficence. What beneficence? Beneficence of? So for as a doctor, I will be concerned whether removing or putting in a ventilator is of benefit, and removing it does no harm, right? Maybe I know that putting in a ventilator is helping the patient, that is beneficence, but sometimes it may not be required. Maybe another patient can be taken in, right? But before doing that, I have to remember that I do not do any harm. So there is a lot of ethical principles which are involved. So you have to see the autonomy, the family decision, what is the beneficence in that situation. Every patient would have his own, her own situations, which will be different. What is the recommendation? And then the do no harm, that is, you have to be very sure that withdrawal of ventilator is required for that. So that is how you need to, I'm just trying to tell you that there is an interplay of ethical principles in all situations. And you have to see what the risk benefit assessment, right? What are the benefits as compared to risks? Now we come to something is justice, as you all told. So justice is treating people fairly, fair selection and distribution of benefits and risks to participants who should be fully apprised about them. For example, if you were giving, if you would have vaccines which were for COVID vaccines, for example, if you will be paying for them, suppose you had a shot only when you had 1,000 rupees. will it be justice? But in India, it was almost free in government hospitals, at least, right? You had to book, that is fine. But otherwise it was free. If it would have been with the cost, what would have happened? Only some of the people would have had it, right? And that would not be justice, right? Do you think that? That means, so for example, you had to have a herd immunity. You had to develop immunity for the population. So you have to have vaccines for everybody. Everybody should have access to the vaccine free of cost, right? Or with minimal cost. So there should be equitable and appropriate participation in treatment. So it is said giving to each what is due. Do you understand what is the difference between equal and equitable? Let us look at an example. A physician notices that most research on strokes in this country are enrolling only men. Is this right? Do you think it is right? Of course, most of the questions answers are no, right? So why do you think it is not right? Anybody? Just your views. Second row, second person from this side, left side. You have the mic, so that is why I'm asking you. Why do you think is it right or not? No, no. That I only. Why is the question? Why do you think? What is your view? You just openly just tell me what do you think it should also be done in women? Underreported, okay. Because there are gender differences. You may have gender differences in the causation of strokes, right? So if you do not identify cause, they have their own hormonal levels. Yeah, they have their own cycles. So you have to remember that you have to have research in which is justified. You have to have women also involved in the research. You cannot have just one part of the population on which you are doing the study. So that is what is justice, that everyone has participation in whatever is being done. So this is you about women. So this is about just about the vaccines, that you have vaccines which were given all over the world free of cost. So that is what is distributive justice. So I would ask the question equal and equitable. Anybody would like to answer? Question answer is almost in the slides if you read it properly. I said equitable, fair, equitable, appropriate distribution of health resources. It is not equal, it is equitable. As per the requirement. Right, good. So this is equitable versus equate. So that is what you already need to remember in this principle of justice. That is equity, not equal. Okay. So just, I think this is the last example. Anybody last row? Pink cardigan. He waits in the room for 3 hours and he's waiting easy for right. So what do you think? Is the ethical principle of justice being served for this patient who is forced to wait in the waiting room? He's been waiting there. The physician examined him, gave him some medicines. He was triaged, but he has been waiting for 3 hours and other patients are coming in and going inside. What do you think? Is this justice? Yes or no? Yes. Yes. Okay, good. So what do you think is the answer to this? It is not equal. You agree? It is not equal, but the treatment is equitable. You agree? Yeah. So this is what is the example. This is equal. These are 2 kids who want to have some apples. Maybe apples, I think they're apples only. So you have 2 stairs, right? This is equality. You give the same size, and this is equity, right? So whatever is required has to be done. Okay. So this is what I was trying to talk to you, equally and equitable. I think you have understood. And so it is not necessary that it has to be equal. So health equity considers distributive social justice. So you have to see that what is to be done. Okay. So this was, I talked about the core principles in medical ethics. And this is something which is in research. This is basically from the ICMR guidelines. They talk about 12 general principles which are related to biomedical, social, behavioral science research. And these are the, so it has to be essential. Whatever you are trying to do should add to the literature and be essential for science. It should be voluntary as per the participants are involved. Non-exploitation, social responsibility. The words are self-explanatory. You should ensure quality, risk minimization. We've already talked. Risk and benefit assessment is very important. You should have the professional competence. That is why whenever there is a project in research or in ethics, we have to see whether the PI is capable of doing that research or not. So that is professional competence. So as a pathologist, I say I'll do endoscopy and take out something. That is not professional competence, right? So we have to see that it is professional competence. So there should be a maximization of benefit, institutional arrangements that you are able to do. If you're doing it, you're saying you'll do this research in SGPGI, you should be capable of doing it. You should have all resources there to do that, right? There should be transparency and accountability, totality of responsibility for the investigators. And of course, as I said earlier, environmental protection is also very important. Okay, so this was all about principles of ethics. If you have any questions.